Together, Columbia and the Stavros Niarchos Foundation are harnessing the power to reimagine how we think about mental illness and improve care. This joint effort of the Department of Psychiatry at the Vagelos College of Physicians and Surgeons and Columbia's Zuckerman Mind-Brain Behavior Institute, embedded in Columbia University's unique ecosystem with the New York State Office of Mental Health, is expanding our capacity to learn how the brain works in unparalleled ways. It's the kind of work that shifts the paradigm.
Nearly 1 in 5 people at any given point in time are suffering from a mental illness. These statistics are horrifying, and the challenges we have in addressing the mental health crisis we're experiencing are many as well.
We're hoping to understand how to take the principles of precision medicine and bring them to the field of psychiatry.
Columbia is an ideal home for the SNF Center because of its world-class expertise in genomics, neuroscience, psychiatry.
Andreas and the Stavros Niarchos Foundation have enriched Columbia and the entire world. They reflect a commitment to humanity, to equality and social justice.
I'm Andreas Dracopoulos. I'm the co-president of the Stavros Niarchos Foundation. Stavros Niarchos Foundation was actually created by my late uncle, Stavros Niarchos, when he passed away in 1996, and we have been around for 28 years. Our mission is quite general. We do things in 4 big areas: arts and culture, education, health and sports, and social welfare. Mental health is going to be a real issue that we have to really face. During COVID, I think we all realized that mental health is something which affects everybody, and I think everybody realized that it's okay to talk about it. To solve a problem, you have to know you have it. As a global human society, we know that we have a real problem, which is called mental health. Talking about it doesn't mean that we have the solutions, but it's a beginning of the solution. 2 years ago, we had the conference in Greece about mental health, and the whole team from the center came. That is Dr. Marks, Dr. Gogos, and Dr. Kushner.
We have this tremendous opportunity and obligation at this moment to connect the progress in science with our ability to change people's lives. The support from the Stavros Niarchos Foundation for this very important initiative is transformative. It's enabling us to approach the problem in a new and different way.
We're challenged in trying to understand our mental illnesses better. We're challenged in terms of the treatments that we have, which are effective, but not effective enough. We can take the expertise of individuals like Dr. Joseph Gogos, who has been building models to study mental illness for decades, and Dr. Stephen Kushner, who has been investigating the genetic basis of mental illness, and combine that expertise with the resources that we have available to us through our affiliation with the Office of Mental Health.
The primary mission of the Stavros Niarchos Foundation Center for Precision Psychiatry and Mental Health is simply put to change the way we practice psychiatry.
Precision psychiatry brings all the benefits of science, biology, every kind of science together, to work together, to be able to, again, through diagnostics, through research, through finding treatment, working with pharmaceuticals. It also brings science to the bedside. It's an old saying, but sometimes we forget about that, and we need everybody to work together.
Precision medicine is the way to go. You target the genes that are involved in the disease process, and then either replace the genes, which can be done in some cases, or correct the products of those genes.
In the next 5 to 10 years, I'm hopeful we will see breakthroughs in diagnostic tools and precision treatments that actually target the biological roots of mental illness.
We don't have blood tests, brain scans, EEGs, objective biological tests that we run in order to make a diagnosis for our patients. That needs to change.
I envision that the center will be able to establish numerous new causes for serious mental illness and set us on a path to designing treatments tailored at that cause.
Colombia is at a place where we have excellent foundational scientific advances.
We are deeply grateful to Andreas Dracopoulos and the SNF for giving us the opportunity to help bring psychiatry to the 21st century.
Andreas has woven much into my life and into the lives of many at this university and in the world.
I'd like to thank him personally because I think we could work together to see to it that mental health is improved enormously globally. Why? Because it'll be based on science, and that's what we're strong at.
This work would not be possible without the visionary leadership of Andreas Dracopoulos and the Stavros Niarchos Foundation. Our vision is to take the mental health crisis out of the darkness and into the light.
We couldn't be happier partnering up once again with Colombia in this center. It's all about collaborating and nobody having the perfect solution, and everybody learning from one another and willing to work together to find solutions.